Welcome to another episode of Future Institute's Future Talks segment. Future Talks is a monthly podcast organized and hosted by Future Institute, a nonprofit organization committed to growing student success and building a better society. Each month, you'll hear from one of our stakeholders, either graduates, program participants, board members, sponsors, supporters, and community members. I'm your host, Cengiz Karatas, Executive Director of Future Institute. Today, our guest is Dr. Jesse Weiner. He's the CEO and Chief Medical Officer at Yellowbrick, a treatment program for emerging adults in Evanston. Welcome, Dr. Weiner.
Thank you so much, and thank you for the opportunity to participate in the good work of the Future Institute.
Thank you. Could you please introduce yourself to our audience?
So I am a psychiatrist and a psychoanalyst, meaning that I have training and practice experience coming up to about 49 years in working with people who have mental illnesses and working with them both from a neuroscience perspective, as well as having the psychoanalytic specialized training in understanding human development, the development of the mind, and how troubles become embedded in people's lives, and how to work with them in relationships for them to heal themselves, actually.
Wow, almost 5 decades of experience is many, many years of commitment. So your dedication to your work is exemplary.
Well, the work of medicine, psychiatry in particular, is a gift because you get invited into the depths of people's lives. What could be more rewarding and more honoring, really?
Dr. Weiner, you are the founder of Yellowbrick. Can you tell us more about Yellowbrick's mission and how it came to be?
It's kind of an extension of the first question, in that my career has been both as a practitioner, working with patients directly, but also as a medical executive. And so I've been medical director in a academic setting, Northwestern, for the inpatient hospital. I've worked in a private hospital system, worked in an outpatient group practice, and those experiences have informed me about parts of the system, the healthcare system, which do not necessarily meet the needs of a certain group of high-risk young people who have serious psychiatric troubles and who need care in an extended period of time. And they need that care over a platform of care that allows them to get the support they need at varying levels of intensity as things come up that disrupt them and kind of provoke their vulnerabilities. So Yellowbrick is an effort to kind of fill a hole in the system for a group of young people that are at serious risk for either death or disability.
From your experience at Yellowbrick, what are some of the unique challenges of emerging adults?
So let's take a little bit of a detour and go into some of the developmental psychology research. So there's a psychologist, Jeffrey Arnett at Clark University, that did research to find out whether or not there were differences between teenagers and, let's call them, mature adults. And are there things about the way in which they experience themselves, the way in which they relate to the world, that is really different than people who are teenagers, adolescents, or mature adults? And he indeed found out that there are distinct differences, and that too has been supported by some of the neuroscience, neuroimaging, which shows that the brains of emerging adults, which are really in a period of, let's call it 18 to 26, that those individuals, their brains operate differently. And of course, the brain is the organ of the mind, so their minds operate differently. And the challenges that he identified, which are also corresponding to the parts of the brain that are struggling to mature, are One, to kind of develop a coherent, integrated identity, to be able to have the capacity both within oneself and within relationships to regulate one's emotions adaptively. Third, to develop relationships which have a full spectrum of different forms of connection and intimacy. Fifth is to develop areas of personal competence, both in terms of things like being able to get to school on time and things of that nature, but also beginning to develop areas of competence that the world values and will pay for. And lastly, there's the challenge to renegotiate your relationship with your parents and family of origin, such that we use a term, connected autonomy, that you're moving towards connected autonomy because there's this paradox in human development where the way in which we all maintain our separateness and our independence is implicitly fueled by knowing that there's a lot of people who have our back, and that it's really that kind of implicit intrinsic support that allows us to move into the world and take all the risks and take all the things that come our way, which a lot of them don't feel good. So those are the universal challenges of moving from adolescence to adulthood.
So major struggles occur during emerging adulthood, like identity and being self-focused and things like that. So is that accurate?
I'll answer it with a personal kind of experience, which is the only thing I envy about young people these days, is that they're young, and that the world that they're having to navigate, I think, has much more peril than at least the world that I grew up in, which was in no way ideal, either. But I think the world's a lot more complicated. We see a skewed population, but I do think it informs what's going on, and in the more, I'll call normative adolescent and young adult world, where I think there's not the same kind of clarity about boundaries, about the relationship to authority, and how authorities may indeed know things that are good for us in growing up. There's while the peer group is very important in terms of how people begin to wrestle with who am I, out in the world, separate from family, I think that aspect of development has become accelerated and intensified, and in fact aggressified by the creation of the social media world. That the normative kind of tensions about peer group acceptance, belonging, identity, that I think those things have become so prominent that they skew attention away from other aspects of adolescent and young adult, emerging adult development, which have to do with competence, and with working with authorities in the form of, teachers, and as the Future Institute, I think, has really thoughtfully introduced, is the role of mentors. That if you look at the literature, that extra parental adults, in other words, adults who are not the parents in people's lives, and how people who have those relationships with coaches, teachers, clergy, wherever they may come from, that those people are more effective and more satisfied in their lives as adults than people who haven't had those kinds of resources. It's also true even for, if you look at capable adults working in very high level kinds of jobs as adults. Those who have mentors seem to have more successful career trajectories than those who have not been able to find that kind of resource within their company or organization.
Yeah, sure. Does some of these issues can be addressed early on? Some of the challenges maybe in elementary or middle school, and if so, how?
That's a really terrific question, not just for me, but for our whole society. Um, and questions like this, which are just so big, I feel like saying, like, boy, I don't want to pretend I have an answer for that. That's way above my pay grade.
Mhm.
But after I take a breath about that, I think the path forward is to say, well, what can be done, by an individual, by an organization? And this is part of why I really became attracted to the Future Institute, because I think you've identified in the Future Institute a particular moment in people's lives that can make a huge difference and can shift the whole arc of a young person's life. Because that transition from high school to college and having support to make that successful is really a critical linchpin for a successful life. Obviously, there's so many other problems, our world, that starting with, how people even address their self-care and health in pregnancy, right? Because we know that affects the child inside. And then, what do people know about what it means to be a good parent? And how do they understand the crucial importance of early attachments and how that sets an anchoring foundation in life for all of us, and on and on,
Right.
and so I think there's many places where really important work can be done. But I think the target that the Future Institute has chosen is a crucial one, especially for people from backgrounds where there aren't a lot of resources, or there are families that have not had the experience of going to college, and how important that is for developing a different kind of life for oneself, and growing one's mind, and being um, able to make use of opportunities that are simply not available in our society without a college education. But it is not easy to make that transition. And all young people, I think, need help. But I think particularly young people who don't have the financial, family, or personal resources to uh, really offer what's necessary to make a change that is very, very different than just going to a different building, for classes. There's a lot of other changes that require um, more self-directedness than in high school. Because in high school, it's really all kind of provided for you. You get the directions: go here, go there.
Mhm.
You don't really have to make too many choices based on knowing yourself and being able to regulate yourself. It's kind of implicit in the system. And after high school, that's just not true. And many young people end up feeling lost and confused and despairing. But there are ways to navigate that with the use of mentoring relationships.
Yeah, there are a lot of factors that contribute to a young person's mental health. Young people often experience an array of problems, as you mentioned, including academic difficulties, health-related problems, poor peer relationships. But while I have you here, I can't really help asking how much addiction or substance abuse contribute to um, these issues.
Substance use is a huge problem among teenagers and emerging adults. And unfortunately, our society and culture is moving in a direction which tends to normalize it, which we can fight about. Is that true for people who are in their 30s and 40s? But there's really no controversy, in my view, when we're talking about brains that are not yet fully developed. And we have evidence that alcohol and cannabis, which are the two most common drugs of abuse, that they are neurotoxic. They are directly poisonous to the developing brain. If you add on top of that a person who is beginning to show signs of a psychiatric illness, there's just no place for the use of substances if you have psychiatric illness, because that begins to derail the ability to, treat that condition and heal with that condition. 75% of all psychiatric illnesses begin in adolescence, that window of adolescence through emerging adulthood. And there's increasing evidence that the use of cannabis in particular is provoking vulnerabilities in young people that might not have become evident if they had not used cannabis. The cannabis that's available today, and particularly cannabis that may come from manufacturers, dispensaries, but even the plant that's available is anywhere between 5 and 50 times as potent as cannabis was back in the days of the hippies, the 60s and 70s. And that potency is hitting vulnerabilities in young people that really derail them and is a serious concern. It's understandable that, a young person who's just severely anxious or severely depressed or, wants to belong and friends are using, it's understandable that substances offer, a moment of relief. There's a psychologist at MIT, her name is Sherry Turkle, and she has, her area of study is what's the impact on self-development, on personal development from all the different forms of high stimulation activities right now. So that includes substances, but also goes towards pornography, computer gaming, the intensity of one's connection to social media. And she has an expression that really hits me hard because I think it goes to the heart of the problem, which is, she says, moments of more where you feel good because, you've smoked up or whatever it is, but moments of more lead to lives of less. And that substance abuse and these other kinds of activities, they create a derailing of how people's minds and brains and personhood grows and matures. And we work with young people, for example, who meth is probably the best example of this, because meth gives you like 10,000 times as many dopamine molecules being released as finishing your homework, but when you're involved with these substances, your brain starts to adapt in a way that you can't feel a sense of well-being. You can't feel good about yourself doing ordinary activities. And so in our work, we're often trying to support people through an extended amount of time where nothing feels good and feels really desperate. And drugs are such a compelling attraction because, it will give you a moment of more. But there's the worry that, those lead to lives of less.
Yeah.
About 2/3 of our patients who have some primary psychiatric condition also have associated substance use as a complication of that.
I would like to move on to the community. I believe you combine treatment with active participation within your community of peers and professionals and institutions, universities and schools. How does that happen? How do you establish that community. And do you partner with schools, or how do you engage with other educational institutions?
Thank you for the question, because it speaks to a way in which Yellowbrick is different than most other psychiatric settings. Most psychiatric settings are functioning kind of within an asylum concept, which is, we'll take you away from the things that stress you, we'll kind of get you in shape, and then we'll, discharge you and say, go get him, champ. You'll be fine, because we've done all this stuff. And my experience over decades is that people get their teeth knocked out, or at least a certain significant population gets their teeth knocked out from that model. And that model is not consistent with how the brain works. The brain matures and creates new connections when you're actually doing the activity itself. Okay? So there's important things happening when you're, for example, talking about doing your homework, but it's only doing your homework that your brain learns math or history or whatever it is. And so we have what's known as a community integrated model. And the difference here is that the work in the world, the development of competence of those kinds, is embedded inside the treatment rather than we're getting you ready for that after the treatment. And we stand alongside people to identify, where are the speed bumps, where are they having trouble, and to help them develop adaptive capacities and workarounds, for whether it's a learning disability or, whatever it might be, for how they can become more competent. And that, competence is really crucial for a successful and satisfying life. So we work with all the local colleges, because we have students, and patients who are students, so with different interests and at different levels of academic capability. And so we get connected with the special ed folks and the disability offices, so that people can get accommodations, and that the school understands that, for example, a student who may have, signed up for 2 classes and, within 6 weeks withdrawn 3 times, that there's a reason to take that person the 4th time. That this is not, a person being, willfully, reckless, but this is a person that's facing certain kind of firewalls and has yet to figure out how to get through them. And so having them understand the context, having them offer accommodations, and trying to mobilize what supports are available on campus for that individual, while we're also providing, supportive resources as well.
You have alluded to that, but do you find any correlations between K-12 students' mental health and college career success?
Absolutely. The burden of a psychiatric illness that has initiated in the teenage years and high school is a significant issue, for a person's ability to make that transition, into college. And that, the fact is that only about 30% of conditions go into remission, and that psychiatric illnesses, like diabetes, like hypertension, like many illnesses, are chronic illnesses that need to be managed. And but there's also a lot of stigma and shame about acknowledging that to oneself, to one's parents, going to doctors, accepting treatment. We all have struggles around getting help, and finding your way through that is really critical, because you're going to need more support. to be successful in college if you have depression or anxiety or obsessive compulsions, or you've had substance abuse troubles. You're gonna need more help. You know, untreated serious psychiatric illnesses not only lead to more failing or not achieving in college, but that it's also, for example, depression is the worldwide leader in terms of the cause of disability. That's worldwide, not just America. And the studies show that people with the more, serious psychiatric illnesses actually have shorter lives by 20 to 25 years. And there's a study by the XIII Foundation that has followed individuals. Now it's probably about 30, 35 years. Individuals who had childhoods that had adverse experiences, which were defined by abuse, neglect, broken family, and it showed that these individuals, as they grow up, have more depression, more suicidal experiences and events, and they have 3 times higher rate of the 7 most deadly medical conditions. The theory being that stress in childhood activates a process, probably of what we think of as inflammation, that kind of creates a shadow over the entirety of that person's physical and mental well-being. And if you have a genetic vulnerability towards, Crohn's disease or whatever it's going to be, that the traumas in childhood are going to activate that genetic potential. And if you're also having trouble getting, good self and other care, you're not going to live as long and you're not going to live as well. The thing that public health studies show is that if you ask the question, who lives longest, who lives healthiest, and who says, I'm pretty satisfied with my life, it's people who have more connections. It's the critical variable for all those, life goals is having meaningful relationships. And so here too, I think, the Future Institute, has its finger on the pulse of what really matters by offering relationships that, are going to, help young people and get inside, their struggles and help them develop the strengths to navigate what is a really complicated life for young people. And it also sends a message too that that counters something in society about autonomy. That as if autonomy and independence exists outside of having support.
What would your recommendation be to school leaders, professionals who are in the position to really provide support to students to strengthen their mental health and resilience?
Yeah, it's again, you ask really great on the point questions that that pain me, because even in my brief introduction to a really high quality school, the Chicago Math and Science Academy, you can see how resources are strained, and that good people who have great intentions and capabilities are limited in all that they can offer. And so I think the schools know what's needed and know how to support young people. And at the same time, I sense how overwhelmed they are. And here too, I think, this is what community is about. It's that schools can't do it on their own either. They need the Future Institute. They need, parent groups. They need, all kinds of wraparounds, to be involved and to be helpful. And my experience with the schools is that they know what they're up against, and that it's very hard for them. I really feel for them, and have a lot of respect and admiration that they work in an environment that limits what they can do.
Dr. Weiner, since its outbreak 2 years ago, the COVID-19 pandemic has disrupted education systems globally, affecting the most vulnerable learners the hardest. So how do you feel is the best way to go about addressing pandemic-related mental health issues?
Well, hopefully we're kind of moving out from under the cloud of COVID, because I think this has affected, all of us, and especially young people, because again, the key is really about relationships, and COVID enforced a kind of isolation that moved, I think, young people particularly towards, again, the social media universe in a way that had some adaptive aspects to it. But I think also without the kind of shoulder to shoulder real world interactions, also kind of spun off some things that were really damaging and hurtful to people. We all got really scared about COVID. It was introduced to us originally, with the first strain as kind of like a black plague, and we all ran, to our isolated corners. And it's been very hard for people to know what the real data is, know what are good judgments about how to get involved in both, being with other people and doing things that are really important, and for which, there's a window of time for certain things. You can't do them later and have that capability. You got to do them when it's time. And so, I think the key to trying to fight, COVID is to find ways to safely stay connected to other people and to activities that are important to your development, and not, allow it to scare us to stop living.
Sure. Thank you. We are honored to have you join us today, Dr. Weiner. Thank you for giving your valuable time and valuable information in your very busy schedule. Thank you.
Well, thank you again for the opportunity and for, the ability to make a contribution within the Future Institute's work.
Sure. Would you like to share any final remarks with our listeners?
Just to wish people all blessings.
Thank you. Thank you. And I want to thank our listeners as well. Hopefully you enjoyed the segment and continue to follow our monthly Future Talks. To learn more about Future Institute, visit futureinstitute.us or follow us on Twitter, Facebook, and LinkedIn at MyFutureUS.